At this time, pass it over to Pima County Health Department to talk about COVID-19 vaccination plans.
Hi team, Louis Valenzuela here with Pima County Health Department. Hopefully everybody hears me okay. I'm a division manager over public health, emergency preparedness, epidemiology, and disease control. So we're one of the really more busy organizations within the response to COVID-19. So happy to address you guys today. I actually wanted to make sure somebody from the vaccination team was available to have this talk with you, but given the changes that are going down at the university, as you have all heard, and also with what is with our lack of vaccine, we just have a ton of things going on. You got me. Given the wide variety of organizations that are here, I'm just going to provide a kind of a big picture overview. Let you know that this is a conversation that's ongoing. We're figuring out vaccination plans as we move forward, and in particular, populations experiencing homelessness. We know that there's a lot of barriers here. One of Dr. Cullen's passions is eliminating those barriers. This is a conversation that she has had with multiple organizations in the past. So this conversation is ongoing. Our pledge is to continue that conversation. I'll let you know sort of where we are from a general perspective. May not be able to answer all your questions today, but I'm happy to jot them down and get back with each and every one of you that has some questions. We still have a lot of questions. So this is a kind of a good audience to start that conversation around. So like I mentioned before, a lot of barriers here. We fully recognize that. Let me give you a little bit of a background of where we are in our COVID-19 situation. Pima County, back in January, we hit our peak in terms of record numbers of hospitalizations and new cases. Deaths are still very high in Pima County. Hopefully those begin to decrease a little bit. There's a little bit of a lag time as you would see in deaths after new cases. And so we're back to sort of where we were in early December around Thanksgiving in levels of hospitalizations and new cases, which is great news for us. Still pretty early to tell whether this is just sort of a plateau headed into another busy spring, or if we will continue to move down. Only time will tell. We hope that mitigation, everybody masking up, everybody washing their hands, everybody staying 6 feet away, is really what's working here. In addition to that, weather's getting better, and it's we fully recognize that disease transmission is less in outdoor settings. So that's all positives working in our favor. Also fully recognize that health disparities that existed pre-COVID have been exacerbated big time during COVID. So health equity, socioeconomic disparities, access to care are certainly things that we are recognizing, working on, and continue to have conversation and prioritizing. And then just a little bit about our vaccination process is, early vaccination data that we're pulling is showing us inequities in the system, inequities in the registration process, in access to vaccination, and in uptake of the vaccine, in how we communicate and promote it. One of the biggest disparities is internet saturation. You really need internet access to actually get a vaccine right now. That is something that we're working on. Our phone team is actively engaged in getting back with seniors that don't have internet access right now, but it's a backlog. So systems just really weren't built to do health records the way we need to process them without internet access. So these are some of those disparities, that we're talking about and trying to overcome. Just some general principles about our vaccine plan is that we really focusing on essentially timely and safe delivery of the vaccine. We don't want any wastage. It is a very sensitive product. It's a very critical product to have, so we don't want any wastage. Our vaccine plan prioritizes that first and foremost. Equitable access, like I mentioned before, and targeting high risk and vulnerable populations is what we're after in Pima County. Not every county in the state is operating in the same tiered approach. We fully recognize that, but according to the data and the science that we have within the county, we've established our tiers very close to kind of the national standards that are happening, and based upon what we're experiencing and what our inequities are like within the county. We know this is going to take a community, so we are working with multiple partners that can do this. So broad and meaningful community engagement is really a priority for us, and we just want to be clear and transparent with everybody that we're making all of our decisions based upon the best public health data that we have and what we're seeing. A little bit of a big picture on where we are now. We've received just under 200,000 doses in Pima County. Not nearly enough. Our priority has been to build capacity to deliver upwards of 10 to 12,000 per day, but we're just not getting the vaccine supply to do that, unfortunately. Proud to say we are about at 180 of those doses delivered. We are looking at another short allocation next week. So we didn't really want to get in this situation, but we're looking at even having to slow down some of the appointments and scheduling moving forward, just because, again, we don't have the supply of vaccine. It looks like it will be getting better in the near future. We are tracking emergency use authorizations for other vaccine, Johnson & Johnson in particular, that are going to help ease that backlog in vaccine, but so far it hasn't gotten much better. We are operating in 5 points of dispensing, what we call pods, that you've probably seen and driven by some of them. Banner is operating 2, one north up by the Cancer Center at the university, the second at our Keno Sports Complex site. Tucson Convention Center is open for walk-up and an appointments only now. There was some confusion with regards to just walk-in visitors, but that we really want to make sure everybody has an appointment there moving forward. The University of Arizona is another partner with us doing drive-through vaccination and walk-up at their campus health services, but are transitioning over to the state-run format, and that has been our heavy lift over the last couple of days. And exactly what the state format is going to look like. A lot of news about the State Farm Stadium up in Phoenix and the 24/7 access there. There's a possibility that that can happen here as well, but the team is boots on the ground figuring that out. We look forward to having a system in place for the state to operate at the university within the next couple of weeks. And then the last is at Tucson Medical Center, who is conducting the bulk of our registrations and ensuring that everybody gets their schedule for first and second dose appropriately, and that we're triaging those first and second doses so we have enough. It's another challenge of ours moving forward. Why we're doing the pods is because we can essentially get through the biggest volume focused on at least a handful of sites. We can get through the most people in the drive-through format and both in the walk-up format. They have the space, they have the storage requirements, which is probably the most important thing to recognize, is that this vaccine is very fragile. Some of it requires ultra cold, low temperatures, -80, that only few freezers have the capability to do. So thus, we made the decision to operate within these 5 pods for now. But we are expanding and we are planning on expanding. Rural services are coming online in Green Valley, in Marana, and with other locations from our federally qualified health centers like El Rio. So accessibility, again, when we have the vaccine, we're building that capacity to do that. And have exercised it a little bit. We did some rural sites over the last week that have worked out really well. So as soon as we know we have vaccine enough in a supply and then also manpower to deliver it, we'll begin to roll it out in that sort of format. So, and like I mentioned before, the challenges are essentially really tied to supply, not knowing when we're going to get the supply, and then equitable distribution based upon that. The supply needs to be triaged so that we essentially get the people that have had the first dose, their second dose, but also following the tiers that we have set by both state CDC and the data that we have about who is experiencing the highest burden. A little bit about our ethics committee. We have an ethics committee, kind of the only county in the state that's operating like this, that is considering all aspects of equitable distribution, and those with functional and access needs, those with ethnic and social disparities that may prohibit their access. These are all great things that are being considered. I wanted to fully recognize them and let you know that we take all of their guidance and considerations into our process and planning. Tribal nations as well. Lots of voices at this ethics platform. Where we are right now is we are in phase 1B in Pima County. 1A was your healthcare workers, up to 40,000 healthcare workers in Pima County. So if you start doing the math, 40,000 of that 180 are essentially done in certain levels, first and second dose, not all, but some. We've moved to phase 1B. There's about 465,000 people in phase 1B in Pima County. So it's a little daunting. Started with the plus 75 age. Plus 75 has a really high disease burden, has been the subject to a lot of the fatalities and deaths, unfortunately. So really wanted to prioritize that group. Are some of our essential workers like firefighters and police that are exposed on a continuous basis, fallen into 1B. Our educators and paid childcare workers are also in 1B, and we've been working on getting that population done as much as possible so that we can resume as much classroom instruction as possible with that critical service. And we look forward to opening up to the 65 plus population really soon. We did 70 plus, I think last week. 65 plus is just around the corner. That announcement may come in the next couple of days. But again, no promises there. A lot depends on our vaccine availability. That's phase 1B1. 1B2 is essentially where we start working into the rest of our essential workforce. Transportation, utility companies, grocery store workers. And what we have done is move social services up into that group as well. So that includes people working in the social service industry and a lot of what we do in terms of shelter-based services as well. Adults in congregate care, adults in shelter and congregate living situations, moved also into phase 1B2. So it's a little bit of a tiered approach. But again, we'll get there when we have availability that touches on populations experiencing homelessness. The other thing we're tracking that's really important for this group is that the Johnson & Johnson vaccine is subject to FDA approval, hopefully by the end of this month. That's a one-shot series. We'll see what happens there. I think that would bring a lot of benefit. We're told there's maybe about 100 million doses sitting on a shelf ready to go. That's going to help us out quite a bit. It's going to help out the social service industry quite a bit. We're looking forward to that coming on board as quick as possible. We realize that there's a lot of in the populations experiencing homelessness that are not going to have the ability to come back for dose 2. We can get them one dose as soon as we have them. That's going to be a great win for us. The model that I think that we are planning on is essentially a mobile model. We are working with adults of 75 plus, again, in that high priority group that we still haven't got to, that are living in assisted living facilities and moving out and vaccinating them in those congregate facilities. I hope that model proves beneficial and useful, and that model can be kind of approached in different other settings. Specifically for populations experiencing homelessness. Other things that we're working on as well, we've traditionally had a member of our team, Mary Frances Bruckmeyer, who's back from a leave, and I think she'll be re-engaging with this community. She is amazing, a nurse, a strong advocate, and we will plug her back into some of this work as well. In addition to that, we are bringing on another support person to work with social service agencies and be that liaison to the public health department, and have this vaccine conversation multiple times over, and talk through the logistics that need to happen here. So a lot moving, like I mentioned before, a lot that I can't promise what's going to happen tomorrow. But just be aware that Pima County Health Department certainly prioritizes, has this on the radar screen, and will engage in conversation as we move forward. Jason, happy to take any questions if there are any.
That sounds great. And thanks so much, Louis, for that update. So do we have questions from the group? It looks like Tom has raised his hand. Tom at Wiki.
Thank you very much for the update. Appreciate that. I have a question if the county or anyone else has collected any information about prevalence of COVID among homeless in the community.
Great question, Tom. So we've had a few instances where we have, through contact tracing, have found outbreaks in congregate shelters, but not nearly what we thought. So while I don't have that data in front of me, certainly look up and see what we can come up with. I would say that those shelter providers and operators over the winter months and continue to do an amazing job with mitigation as best as economics and logistics allow. So kudos to everybody out there for doing that. We have not had any large scale outbreaks to note in those sort of congregate settings.
Thank you. That's good to know. One of the reasons I mentioned that, and others might have the same need, is that the state through DES is putting out some money for rapid rehousing and other things that's due on Monday. And that's one of the questions they ask is what's prevalence or what's happening with COVID with the homeless population. So any information that you can provide, I'm sure will help other people's applications.
Thank you. I will see what I can come up with and shoot that maybe out through Jason.
That's perfect. We can share with the group. Any other questions for Louis? All right, I guess not. So Louis, thank you so much. Oh, I saw Daniela's hand was raised momentarily.
Just going to ask if there's any indication of how the spread of any of the variants here in Pima County, and does the county health department think if we can get vaccinations, we can get ahead of sort of the variant spread?
Yeah, absolutely. Absolutely. That is our thought, is as quicker as we can get the vaccinations out, the quicker we can get ahead of variant spread. We have not noted it in Pima County just yet. That doesn't mean it's here. Genomic testing is really tricky. We have to identify people that are subjects to send that up to a really specific lab, either in CDC in Atlanta or another in Phoenix. And we've yet to identify, but we are putting surveillance networks into place for it. But yes, definitely a concern. And that's why I say always keep masking up, always keep washing hands, always maintain that distance, because we don't know if our decrease right now will stay that way with the new variants coming.
And it looks like Ana Lucero has a question as well.
Yeah, I thought I heard you say that maybe the Johnson & Johnson would be, and the one dose might make more sense for the homeless population, but yet, the research shows that it's not as effective. And I wonder if you wanted to speak to that.
Yes.
And really, I want to know how the continuum feels about that.
Yeah, certainly. So Johnson & Johnson is promoting their vaccine to the FDA for emergency use authorization ends of this month. We fully expect it to be approved. one dose series, but 85% effective at the top level to prevent severe disease. Again, it's something that if pushed out in volume could help us get ahead of the variant spread. But we recognize that it's a little bit less than it's got Pfizer and Moderna, the vaccines that are out there in the 2-dose series, are ahead of that, and for about 10 to 12% efficacy. It is a little bit of a concern, but we recognize if we can get people in for one dose, 85% is pretty good and better than nothing. So that's out there. The other tricky thing here is that commercial pharmacies will be coming online really soon. We don't know exactly how they're going to operate, what product they're going to be using, what their distribution plans are going to be. So again, transparency is a challenge for us, figuring out how that's going to work, how federal rollouts will work moving forward. It's all up for debate still at this point.
All right, and it looks like Dia has her hand up as well. And so Dia, I think this will be the last question we'll have time for.
No pressure. So it's a follow-up. Anna had asked, what does the continuum think about this as well? And I just wanted to send it back to you, Louis, and ask, I know it's less effective, the Johnson & Johnson, compared to the 2-dose vaccines, but comparing it to other vaccines on the market for other diseases, is it that bad? I think sometimes we get wrapped up in the fact that it's not as good as the one that exists. I'm curious, as a vaccine in of itself, isn't it good anyway? Like, could you speak to that?
Sure, absolutely. So, just to compare to the regular flu shot, we have years where the flu shot itself is only about, 50 to 65% effective. But we roll it out anyway because it has a high percentage of preventing severe illness. And that's really what we want to do, is we want to impact or have an impact onto healthcare capacity and make sure that people are staying as well as possible. So even when the flu shot isn't a really good match for the circulating flu strain, we still promote it because it's got that percent of efficacy to prevent illness. And at the end of the day, if we can save some lives, we certainly will do that by promoting some vaccine over none at all.
Great, thank you.
Yes, sorry. Just gonna move us along. Thank you so much, Louis, for joining and presenting an update and answering all of our questions.
Sure, yeah, no problem. Thank you guys.